we'll talk about it.
Can somebody like screen share a computer? Can
Yeah, let's do that.
I mean,
This is kind of ironic, I'm using a student computer to do it. I think it's hilarious. At any rate, actually, no, I don't, I'm kind of frustrated. What? We'll deal with it. So I figured it'd be smart to start with joints first, and then we go into appendicular skeleton, axial skeleton, and bones, bone structure. So we'll be, like, my son shot a deer last week, and I wasn't saving hearts. Oh, yeah, I did actually save the heart because he didn't damage it. But joints, right? So like a back leg and a front leg, the meat's been cut off, but
I always used to play with those.
I brought a couple of those. I will bring a couple of those. We get a couple bones. The Walker plant will cut, for example, a big cow femur from the top to the bottom of the bone longitudinally to see spongy bone and to see exterior calcified bone. And so just a word of wisdom for this unit. This last test was pretty homemade. It was made by me. And it was not necessarily too booky, right?
No.
It was kind of like, what did you do in class and what should you learn about your skin and tissues? This next test is the reverse. So chapters 6, 7, and 8, somebody can look at how many pages we're talking there. I don't have my book out in front of me. But it's going to be more booky. It's going to be more memorization. You'll have to know quite a few bones. You'll have to know parts of bones. You'll have to look at shapes of bones and talk about specific parts of bones and joints as well. So we start with joints. We know that bones are connective tissue allowing my body to move. Some of you guys are going into healthcare, so you're going to see knee replacements, hip replacements, all sorts of problems with our bones due to things like osteoporosis, etc. All right, so can I expand this on my screen? Yes. All right, so joints attach to bones, providing support and protection and allow for body movement. Joints are categorized by their structural classification and their functional classification. So there's going to be a lot of hard words coming at you here today. What we're going to break down, how are we classifying human joints? And so think about the joint cavity. We know we're going to have some ligaments hooking bones to bones, right? We know we're going to have some tendons hooking muscle onto bone. And so those two dense connective tissues are always at play. That's where we get into some trouble with our joints. A lot of us have had joint injuries probably. But we know also that there's synovial fluid in there. There's bursa, sacs. Bursa is here to reduce friction.
Is that when you get bursitis when they fill?
Yep, if they fill too much and you have maybe been working too hard, you can have a lot of fluid in your bursa sac. They can become inflamed. You have articular cartilage and synovial membrane. So like if you pop, let's say you pop all the knuckles in your hand, you're really just moving that synovial fluid around a little bit. You're not really damaging anything, but that's what is making that noise, is just the movement of synovial fluid. 3 types of joints if we classify by function. So keep in mind that we are on function. What does it do? So by the degree of movement possible. So diarthrosis, there's a lot of terms here you maybe have never seen before, but di means two. These are freely movable joints. So think about the logic. This is by function. Shoulder, knee, think about movement, hip, elbow, interphalangeal, here, tarsal, foot, carpal, wrist, right? My wrist moving in 2 directions. Freely movable. You can rotate around. It's not going to break it if you rotate it at any angle. Obviously, if you have pressure or something on your knee, our knee mostly does this, but there is some flexibility side to side, up and down. Same thing with the other ones, right? Think about general direction of movement. Okay, so those are diarthrosis, very common. Amphiarthrosis, slightly movable joints. So my joints in between my disc and my back, I got lumbar, I've got thoracic, I've got cranial, areas of my vertebrae. So in between there, we have a joint in every one. Costosternal joints, where would those be? Where's my sternum? Sternal here, okay? So joints in between your sternum and your rib plates. Pubic symphysis, anybody know where that is? If you shoot a deer this weekend, you are going to cut through the pubic symphysis to gut it. Where's the pubic symphysis? Right between the back legs, right? Right between the hip joints coming together is a pubic symphysis. And synarthrosis, joints with little or no motion, no movement. So what shouldn't move are scalp sutures. Mental symphysis, teeth should not move in their sockets. First costosternal joint. So you can see coming from the top down, these are more common at the top. Synarthrosis are not as common. So good strategies for memorizing lots of material, right? You think about bones in the body, you're gonna have to know quite a few bones, name, terminology, parts of knees, parts of hips, specific joint names. It might be a good time to look for a flashcard app or use flashcards, make your own flashcards. Due to the amount of stuff in this unit. Last unit, not a big deal. Why do we sweat, right? Why do you have hair? It's very common sense sort of stuff. A lot of this, like, look at that slide right there. How many of those words have you never seen before? And so you might want to revert to some sort of flashcard or I don't know how you guys, how do you do that in other classes? Do you have to memorize anything in your other classes? Not really, okay? So, whatever your trick might be there. CNAs, I'm just kind of curious, this is just kind of going through my head as you guys are writing this down, but have you tested out on like clinical stuff already?
No.
Not yet?
You should have got an email about when we're going to be done.
I did, so is that where you show them like how to insert a line or how to,
We can't do that.
what are your test outs?
It's like how to dress.
Yeah, like
How to do a dressing, how to, okay.
It's most, and maybe just like,
Making their body.
yeah.
Okay, so is it that where you have to do perfect on it or you don't pass it?
It's not, I don't think it's like perfect, but
But close
there's
to
like
it?
certain tasks you have to do.
Are you talking about like the state test?
Yeah,
Oh yeah, like they give you 5 random like whatever things to do.
yeah,
One of them is hand washing for sure, and you just like
yeah,
you just have to maintain good whatever. And then another one is something with like measuring something.
okay,
And then yeah, and then the last 3 are just like random.
okay.
Yeah.
So that's what's coming up, that's what the email's about?
Yeah, I'm guessing that's
Okay, perfect. Yeah, that's a stressful day, you got a lot to remember there too, don't you?
Yeah, and then you have to do it online. Yeah, then you have to do the online version
Oh,
before.
okay,
Yeah, it gets kind of nerve-wracking.
yeah. Okay, so we can also classify joints by structure. So the previous slide was function, like what do they do, how do they do it? This is about structure. So synovial, you guys have heard of synovial fluid, right? The fluid in between there to help you decrease the friction between two bones moving. So like if you have a lady with osteoporosis and they're in total pain, chances are their bones have become decrepit. They might be bone on bone with no synovial fluid in between there. and nerves are still operating, so you can see why these people might be in a lot of pain. Synovial joints are bones are separated by a joint cavity, lubricated by synovial fluid, enclosed in a fibrous joint capsule. So that would be your cartilage and your ligaments and your tendons all operating together. Synovial joints would include the shoulder, the hip, the elbow, the knee, the carpal right here, and interphalangeal here. Believe it or not, there's fluid between every one of these joints. So that's why you can hear people pop their joints in their fingers. So yeah, they're extremely complicated. Ligaments we know are made from dense connective tissue, avascular for the most part. So I got a bum knee. Well, why isn't it healing? Because there's very little blood flow to those areas. Meniscus can tear. We'll learn about all the parts and pieces of a knee. As we think about knee injuries, we will think about types of motion that these joints can undergo as well. So you got a fibrous capsule around here that would be made out of dense connective tissue. You have a synovial membrane, which is holding that fluid in. All right, so that's organized by structure. So we got to do a couple more here for structure. Okay, a fibrous joint. Fibrous joints are bones held together by collagenous fibers made from collagen, right? Extending from the matrix of one bone into the matrix of the next. Think about how complex your whole ankle area is. No, there is no joint cavity here. Skull sutures, teeth in the sockets. Distal radial ulnar. Distal radial ulnar would be in this region. Tibial fibular down here. Tibia fibula. So two bones in your lower leg coming together. That joint where they are meeting up with your foot is called a fibrous joint. My brother-in-law, he's currently home for deer hunting. Anyway, he works in cold storage buildings like Stouffer's, these huge warehouse buildings, building these buildings all over the United States. Anyway, he was up on a tall plank, putting a ceiling in a building or whatever. I want to say 12 to 50 feet off the ground, and he fell and totally just landed feet first into the concrete. So needless to say, he has a lot of problems with his fibrous joints in his feet. So kind of compression that is not really able to heal very well. Okay, you done with this slide?
No.
Okay. Well, you rocked out your test yesterday, the part I've graded, being gone all week. Your concussion must be gone. Your eyes look pretty normal today. Are you all better?
Yeah, I slept really hard last night.
Yeah, good. When you wake up and you just feel like $1 million? Oh, yeah, that's great.
Well, guess what? I'm outside.
Don't get on him with all
I
this stupid helmet on.
I put my helmet on and I'm having someone hold the horse while you're on, so you can't run away.
Or pointing him. Have somebody pointing him. And when you figure out he's finally calmed down, then you can take the lead on.
Keep it joint, not the socket.
It's technically a joint where your teeth are connected down in there. Okay, moving on.
Okay.
Okay, this is number 3 under classification. So cartilaginous joints. Bones that are held together by cartilage. There is no joint cavity. The epiphyseal plates of our long bones, that is your growth plate, right? So I don't know that I can see a growth plate on this picture. But like if you would break a bone, they're going to check that suture to see, like they're going to say, are you done growing yet? how old are you? And they're gonna look at those epiphyseal plates. Because if you break it in a key area, then it could hamper your growth. Coastal sternal joints, pubic symphysis is cartilaginous, that's why you can cut right through it with a knife if you are a deer hunter this weekend. Intervertebral disc are cartilaginous joints as well. So a lot of our people are hampered by our bone degenerative diseases, osteoporosis or scoliosis. My mother-in-law currently is in just a huge amount of pain. She's 82 years old. She's got scoliosis, which is curvature of the spine. You guys still get checked for that, where you have to have somebody press on your back and you lean forward while they feel your spine? You still have that done as little kids? Okay, and so she's got scoliosis, she's got stenosis in 2 spots on her backbone. So if you think about stenosis, you got a vertebrae. I'm not gonna try to draw a good vertebrae. You got a vertebrae and you got a spinal column coming through, right? So this is nervous tissue, this is bone tissue. Stenosis just means that's all closing in on her, putting pressure on her spinal cord in 2 different spots. So she's looking for pain meds all the time. So this is pinching in. One of them is like 75% stenosed, like closing in on that spinal cord, which you can see would be very painful. So yeah, these are cartilaginous joints. They can degenerate due to wear and tear, due to degenerative diseases. So right there, that arrow is pointing to pubic symphysis. All right, joints are designed for their function. Let's look at sutures, our first example. 4 sutures in the top of this head. What function do you suppose sutures are designed for? Look that up anywhere you can find it. So these are the eyeballs down here. I got a suture here, number 3. This guy right here. Go look it up. What are the names of these sutures in your head? Google search sutures in the head.
Coronal, sagittal.
Okay, where's the coronal one at? These are your eyeballs. Number 3, these are both coronal. Okay, what's this one going to the back of my head? Sagittal. Okay, and what is this one cutting through towards my eyeball?
I don't know how to say that.
Spell it.
Yeah, Lambdoid. Lambdoid.
That boy. So you have, what's the purpose of these sutures?
Hold your head together. Allow growth.
Allow growth, very good. So if you have a baby being born, these sutures are not hardened. This whole soft spot area is right here, right? Cartilaginous tissue. Baby's got to come through the birth canal. Baby's head will change shape as it's being born. Sometimes you see babies that have somewhat of a cone head, right?
Cone head.
What?
Is this a letter? My little sister was like an alien.
Some babies actually have to have, like the mother has to have help giving birth, so they will hook on a suction device and pull the baby
Like a vacuum?
out. Yeah. So that is going to alter the shape of their head, but it will go back to normal. It will harden with time, or you don't have to be so careful with those sutures. So these allow for growth. What function do they serve? They allow for growth. Are your sutures currently hardened in your head? No, except if you're full of force. Yeah, they are hardened in your head. Let's look at some symphysis pictures. What kind of joint is a symphysis? What kind of movement is possible?
Wait, what did we write down for the sutures?
Well, name 4 of these sutures. We gave 3 names.
What were they?
There's four: metatopic, coronal, sagittal, limb.
Say
those again,
so slower.
Just that was
Or right on.
No, it's just metopic. No,
Yeah.
no A.
metopic.
Coronal. And sagittal.
Okay, and we said that they're designed for growth, to allow growth. All right, so moving on, let's go take a look at, I keep going the wrong way on this, I'm not used to this. Okay, what kind of joint is a symphysis joint? What kind of movement is possible? Name the obvious symphysis in this picture. This is your hip bones, where's your symphysis at? Pubic symphysis, right? What connects the bones in these joints? What is that? Cartilage, right? What kind of movement? Is there no movement? Is there a little movement? There's no movement. Okay, synovial joints, how do they differ from the previous two? Okay, movement or no movement? Synovial. Movement, right?
Where are we, Susan?
We're jumping around everywhere.
Yeah.
We're on Tuesday?
Five main structural characteristics of synovial joints. So you have articular cartilage. What kind of cartilage is articular cartilage? We had hyaline. What were your other two kinds of cartilage that we just tested out on? Hyaline, fibro,
Elastic.
elastic. Okay, so if I'm talking about a synovial joint, what type is this? What's the shiny stuff at the end of bones? Starts with an H.
Hyaline.
Hyaline, okay? Where do we find it? In between bones. What does it do? Why is it shiny? Why is it slippery? I don't have my deer leg here to show you that today, but we've all seen it, right? You've seen it probably cutting up animals or deer or simply looking at the end of a raw chicken leg, right? Slippery. It oftentimes has kind of a bluish appearance to it. It's shiny. What does it do? Maddie, what's it do? Why is it shiny? Why is it slippery?
Because they have
What?
the fluid in there.
It allows movement, and they're here to decrease the force of two things rubbing together is
Friction.
friction, right? So what does it do? It's decreasing friction. So there's fluid in here, called synovial fluid.
So fluid reduces friction.
Yes, and hyaline cartilage reduces friction. So when I actually try to leave these stupid little deer legs somewhat intact, right? Cut them open with a knife and look at like there's nothing connected to it because it was sitting right next to the synovial fluid. And like I said, they appear kind of bluish, kind of slippery. And if you push the joints, the two bones that connect in the joint, move them, you can see how friction is decreased. Okay, so a lot of you guys going into the medical field are going to experience people with problems, right? Normal joint on the left-hand side. Notice your tendons, notice your ligaments, your bursa sacs, your synovial fluid amount. And then take a look at bone ends rubbed together, osteoarthritis, coming from age, coming from overuse, coming from a bad diet, possibly not eating correctly, calcium not necessarily keeping your bones strong, or other injuries. And then you can have the flip side. Rheumatoid arthritis is an autoimmune disease. That means my body kind of attacks itself. And that's what's going on the swollen, inflamed synovial membrane on the right. So obviously both of those are going to have trouble walking due to bone on bone, I would guess would be more painful than this rheumatoid arthritis situation. I've not experienced either to know that, but just looking at my mother-in-law, eroded cartilage is very painful. All right, so your sutures are nothing more than connective tissue in your skull, holding your skull together. This picture is just showing you what we've already talked about, a blown up picture of things that you should know, a joint capsule, articular cartilage, fluid is the blue stuff, and that is a healthy joint. Okay, we're going to move on into areas of words for motion. And there is a video I was going to play today. I might just assign it. It's sitting on YouTube. But think about all the ways that your body can move your various joints. So if I have plantar flexion, yes, you will have to know these. I just want to throw that out there. You're going to see a lot of words here that you maybe don't know. Some of them are easy. Well, if I extend my leg, that's easy. If I flex my leg, it's coming back towards midline. If I extend it out, my extension muscles are working. Flexion muscles here are working. But there's other terms that you maybe don't know. Some of you guys might know them from like machines at the pack, right? Adduction, add it together or pull it closer to midline. So if you're adducting your leg, you're pulling it in. If you're abducting your leg, you're pushing it out. So think about like physical therapists. They bring people in, they're working with injury patient probably, and people just, have to get their muscles all working again in the right angle, which means your joints have to work at the right angle. Dorsiflexion, pull towards your tibia. Plantar flexion, push towards the floor.
But like, can you do that with like your wrist too, or would it be something
Yeah,
different? Or is
yeah.
it just like specific?
Dorsiflexion. It's not called plantar flexion, but yeah. So up on the top up here of that wrist picture, hyperextension, extension, pull out, flexion coming towards your radius. So terminology is important, especially if you go into OT or PT or anywhere where you are helping people to gain strength. Okay, so we're going to be practicing this just like we practice our body direction terminology, rotation. I don't have to move anything for rotation, but you're simply just changing the position of your arm, which is very different from circumduction, going like this, supination, pronation, supination, pronation. So, practicing, these are good flashcards as well, or however you learn your terms. Eversion versus inversion. So we got a big toe here, inversion pointing. If I take my big toe and put it towards midline, inversion, eversion, big toe out. Protraction, retraction. You guys can practice this one sitting there. Give me a retraction. Give me a protraction. Give me a elevation of the shoulder. Give me a depression of the shoulder. Right? And so different muscles helping you do all those motions. All right, so I'm going to take you. I won't be able to have any sound if I stay on here. I'm going to go fight with my computer, and I am going